Hello everybody, as promised we're going to be doing a video today on how you can help somebody who is having a life-threatening asthma attack. Just before we do that, we need a very basic, quick understanding of what asthma actually is and what happens to the body during an asthma attack. So the area that we are focusing on today is the lungs, and in particular your bronchus, which are the tubes that lead down into the air sacs or the alveoli where gas exchange takes place. Now, during an asthma attack, which can be caused by pollen, dust, smoke, exercise, cold air, there's lots of things that can cause it. Whatever it is, it's going to cause this bronchus or bronchi to constrict and become really, really inflamed. At the same time, the body produces a lot of excess mucus into this area, which is really hard for the patient to cough up. Ultimately, this leads to a big problem when it comes to breathing, particularly breathing out. So, how are we going to recognise somebody who is suffering with an asthma attack? First things first, they're obviously going to be very, very short of breath to the point where they might not even be able to talk to you in full sentences. The likelihood is they're going to be leaning forward because this gives them the sensation that their airways are a bit more open. They might look quite pale, potentially a little bit clammy, and in severe cases they might even go blue around the lips. Now, something really important to listen out for is a wheezing noise coming from their airway. Now, if this is a life-threatening asthma attack, you won't need a stethoscope to hear this. You'll be able to audibly hear it in the room. And in particular, we're looking for a wheeze when they try to breathe out. And I'll explain the anatomy behind this at the end of the video if you want to know it. So, once we've recognised that that patient is having a life-threatening asthma attack and they give you consent for you to go and help them, we need to find out if they have one of these. This is a salbutamol inhaler. In the UK, they're traditionally blue. And it's the blue one that we really want because this has a drug in it called salbutamol. Now, salbutamol is a bronchodilator. So in layman's terms, this area that's really constricted and inflamed will open up in theory and dilate to allow more air movement after using this drug. Before we give it or assist to give it, we need to ensure that it is indeed salbutamol inside the pump, or its brand name is Ventolin. Once we've confirmed that, we check to make sure that that drug is in date, because just like food, medication goes out of date. Once we're happy with that, we can help assist that patient take their inhaler. Now, ideally, we want to give this inhaler with this. This is called a spacer. They come in different shapes and sizes, different colours, but they all do the same thing, and they all look quite similar to this one here. It's very, very easy and simple to use. We place the inhaler in the end of the spacer, and what this is designed to do is hold that stat dose of salbutamol, and when they feel ready and capable to breathe that medication in, they can take the end off and inhale. Okay? Now they can have up to 10 puffs of their own salbutamol inhaler, and you want to space these reasonably apart. So we're talking 30 seconds, maybe a minute, to give them time to see whether or not they're feeling any relief and to give them a chance to get ready to inhale the next amount of salbutamol, because when you're struggling to breathe, it takes a lot of effort to actually coordinate pump and breathe at the same time. It's quite difficult. Now, if they don't have a spacer, they can just simply put it in their mouth, or alternatively, if you have a disposable coffee cup, a paper one, you can just poke an end in the hole, put the pump in there, and they can use that as a makeshift spacer if they feel as if they would really benefit from their spacer. Most asthmatics should be carrying their pumps and their spacers on them at all times. Now, if you've given them up to 10 puffs of their own salbutamol inhaler and you're not getting the relief that they need, or if they continue to deteriorate, then it's this point that we need to call 999 and let the ambulance service know they're having a life-threatening asthma attack and that they need to dispatch an ambulance as quickly as possible. Whilst you're waiting for the ambulance, keep them sat upright, keep them reassured, keep them calm, okay? Hopefully we will be with you shortly. If they collapse or become unresponsive, let the person at the end of the phone know what's going on and they'll talk you through the next steps. Now, if you want to hang around for a moment more, I'll tell you about the anatomy behind asthma and the breathing situation. So we know that the bronchus becomes constricted. Now when we breathe in, this is called an active process. Now by that it means that we can physically force air into our lungs, and when we do that, our diaphragm, which is a dome-shaped muscle, will flatten. This will lower the pressure inside our lungs and allow room for that air to enter. At the same time, our intercostal muscles, which are the squishy bits in between our ribs, they will expand out to make room for that movement of the lungs. Now, when we breathe out, this is called a passive process. And a passive process means we don't actually have to physically do anything. The diaphragm and the intercostal muscles will simply naturally recoil back into place. When this happens, this will raise pressure in our lungs and force the air out. The problem is with asthma is that we've got all this constriction going on in the bronchus. And because passive breathing isn't something that requires a lot of effort, we don't have the oomph behind it like we would to breathe in, to exhale and push that air past that constriction. This is why we get a build-up of CO2 in the alveoli, in the air sacs, which can be dangerous if it becomes too high. And it's also why we hear that wheeze. It's because we're forcing the air, or trying to force the air through a constricted area, and it's just not working properly. But hopefully with that salbutamol inhaler, we can ease that stress a little bit for the patient, and we now know when we should call 999. If you've enjoyed this video, please hit like, feel free to follow on other platforms, and if you're interested in doing some face-to-face training with myself or my colleagues, we're based in Buckinghamshire at ALR Training and Events. I'll pop the link on the screen and I'll also put it in the comments below. Feel free to contact us if you're interested in any other courses, and I look forward to delivering another one soon.